Hello, my name is Fumilola Taiwo, and I'm here to deliver a presentation on the roles and the responsibilities of a registered nurse. That's my Access to HA Unit 8 course assignment. And then I am to deliver a presentation, as I said, on the roles and the responsibilities of a registered nurse. So in this particular presentation, I will be discussing the changes, the impact, and the roles of the Nursing and Midwifery Council in relation to nursing practice. I will be giving an analysis of the implication of the code on the role of the registered nurse and the need for effective communication in a multidisciplinary healthcare setting and its effectiveness. So I'll be going to my slide 2, and my slide 2 is talking about who is a registered nurse. Nursing generally is the use of clinical judgment in the provision of care to enable people to promote, to improve, to maintain, and to recover their health, or when death is inevitable, for them to die peacefully. So a nurse then would be someone, a professional, a learned professional, who uses clinical judgment to provide care in order to enable people to promote their health, to improve their health, to maintain it, to recover back to the normal health that they used to be, or when death is inevitable, for them to die peacefully. There are 4 fields of nursing, and the 4 fields are: we have adult nursing, we have children nursing, we have the mental health nursing, and there is also the learning disability nursing. So a nurse, a registered nurse, is expected to have one of these degrees, either have a degree in mental health nurse, adult nursing, learning disability, or child nursing. And if you are able to, you can definitely decide to be to have degrees in all of them if you're able to, but at least you must be a graduate of one of these fields. So there are 4 fields to general nursing, as I said, and nurses are a major backbone of the NHS. They assess patients, they provide care for patients before and after medical operations, and they take samples and administer medication. And as a registered nurse as well, you're supposed to possess the 6 C's of nursing, and that is being compassionate, being caring, being courageous, being committed, and all that. So if you are a nurse, you're meant to be able to communicate well, to be able to be committed to what you're doing and all that. So that is one of the attributes of a registered nurse. This is my slide 3, and it's talking about the evolution of nursing. And when we're talking about the evolution of nursing, we're talking about how nursing evolved in the UK. How did it all start? Where did it start from? And the first nursing training school was founded by Florence Nightingale in 1860, and that's the picture of Florence Nightingale there. She was the very first woman that initiated nursing in the UK, and that was as a result of the challenges that the UK was going through because of the Crimean War then, when the armies were dying of diseases and all that. And so she was invited, because of the experience she's got, to come in. And when she came in, she was able to help to put a stop to all the, to minimize and eventually put a stop to all the deaths that was the increasing deaths of the UK army then, because she initiated the use of hand washing, hygiene and all that. And she brought about, with her experience, various things that helped the helped during the Crimean War, and that really helped to reduce the rates of the armies that were dying then. And as a result of that, the UK government compensated her with some amount of money, very large amount of money, and that was what she used to build the hospital in London. And inside that hospital in London was where the first nursing school started from. So it started in the hospital in London. So the first nursing training school was founded by Florence Nightingale in 1860, and it set the standard for modern nurse training. So Ethel Bedford, that's a picture down there. She led the movement to claim professional standing for nurses. So this led to the Nurses Registration Act in 1990. So she fought to ensure that nurses were given a professional standing, not just being a training thing. So nursing then was moved from the hospital to moved outside of the hospital, and it became a professional thing, and it was moved to the universities, and that was where nursing became a thing that people have to go to school to study and then bag degrees at the end of the day. So the General Nursing Council was set up to maintain a register of general nurses and specialist nurses. So nurse education came to a close in the mid-1990s and moved away into universities through Project 2000. That is my slide 4, the recent changes and the impacts. Nursing as from inception, that is talking about some of the changes in nursing from when it started up until now. So right from the onset, nursing has been a female-dominated profession. Somehow people believe that the female folk should be the ones doing nursing, because everyone tends to believe that, oh, the females are the ones that are used to doing care and all that. So most time, as a result of this, it was a very rare thing for the male to be in the profession. So male nurses recruitment level is still low, even right from then. In the year 2016, 11.4% of registered nurses in UK were men, while 10 years ago, there were 11.5%. So every effort to promote the number of men in the nursing profession remains low, including the proportion of nursing students in the UK. So despite the fact that as at that time, the male wouldn't want to go into nursing, it has really changed a bit, but it's still very low compared to the rate of the female in the nursing profession, and even the proportion of nurse students in the UK is still very low. That is my slide 5. And slide 5 is going to be talking about, I will be talking about political changes in my slide 5. So politics has got a major impact on nursing roles as the government determines the level of funding allocation. So politics has really impacted on the NHS as a result of the fact that whatever comes in for the government, whichever government is in at that point in time, they make laws, they make decrees according to what their government wants for the country at that point in time, and those laws, those decisions impact on the NHS. So and also, apart from the political changes, the level of funding, because the government determines the level of funding allocation that goes to every sector. So whatever funding that will be coming to the NHS is being determined by the government, and whatever comes in for the government will determine what the government will release to the NHS. So if the funding, if the government budgeting, if the government is able to realize enough, the budgeting of the NHS will be increased. But if the government, whatever comes in for the government is reduced and it's not as expected, it will definitely have an effect on the NHS. And not just the NHS, It will have an effect on the patients. It will have an effect on the nurses. It will have an effect on every decision that is being made in the NHS, and that will definitely impact on the nurses. So the NHS Act of 1946 had a great impact as care was shifted to patients and nurses became accountable for their decisions. So the 1990 NHS Act aimed to improve hospital and GP services. So the Patients Charter Policy moved care to the community and nurses became advocates. So as you can see, the 1990 Health Service and Community Care Act, its overall mission was to shift resources to primary care by introducing fundamental change in the management of hospital and family practitioner services. The 1990 Act also represents a major shift to community-based care, privatization, accountability, quality assurance, and cost containment that was envisioned over 30 years ago. Slide 6 is also talking about other changes. So we have economical changes, which stems from the fact that the NHS budget is based on government income, and a depleting government income decreases the budget allocated to the NHS. Others are social changes due to aging population, technological changes due to medical and healthcare innovatives. This also reduced errors and led to professionalism, and new roles and new career paths also emerged. So all these changes led to errors in the NHS being reduced by the nurses, by those changes, and then the new roles and new career pathways also emerged. So the NMC roles in nursing. The Nursing and Midwifery Council in the UK is the UK regulatory body for nurses and midwives. They regulate and promote high education and professional standards across the UK for nurses and midwives. They maintain the register of professionals eligible to practice. They investigate concerns. They speak up for a healthy working environment. They share intelligence from regulatory activities to support workforce planning and decision making. Slide 8, the NMC code implications on nursing. So the NMC, that's talking about the Nursing and Midwifery Council. They regulate and set frameworks for nurses to operate. And then the Mental Capacity Act also empowers people without mental capacity. The NICE improves the outcomes, the NICE improves the outcomes for NHS, for public health and social care users. The Children Act of 1989 safeguards and protects children from abuse and neglect. So these are all, codes that came up and has been of immense value to the nursing, to nursing in the NHS, because all this has really helped the nurses in clinical governance. It has helped them in evidence-based guidance, thereby increasing their professionalism and accountability. It has helped them to deal with concerns. Concerns are also dealt with under local safeguarding procedures available within the work environment. Slide 9. So my slide 9 is talking about the effective communication in a multidisciplinary approach. So this involves professionals like physiotherapists, physicians, nurses, specialist nurses, and social workers communicating as a team to use their expertise with the support of the patient, with the support of the family members, and the support of the community in a transparent and collaborative way. So when we're talking about effective communication in a multidisciplinary approach, we're talking about different professionals coming together to reason together, to work together, to form a teamwork, and to agree on the care of a patient. And this is supposed to be also in support of the patient as well and the family members. And this helps, and the community as well, in a transparent and collaborative way. They come together to join us together to come up with a reasonable support and a solution to the care of the patient. And then this encourages effective teamwork. That is talking about effective communication. When there is an effective communication between the professionals, it encourages effective teamwork. It promotes continuity and clarity within the patient care team, because when there is good communication, if any of them leaves, probably some other people comes in, whatever has been communicated, if it's been effective, it will lead to that being, it will promote the continuity and the clarity within the patient care team. It also encourages collaboration. It fosters teamwork and prevents errors, because there is no how you will communicate effectively and there will be error. But when there is an ineffective communication, there are bound to be errors, there are bound to be no teamwork, and there are bound to be lots of things out of place. My slide 10 is talking about the effectiveness of the multidisciplinary approach. So through this multidisciplinary approach, policies and guidelines are followed by all the team members through good leadership, through strong teamwork, through mutual agreement, through commitment, cooperation, mutual respect and openness, through trust, agreed framework for reviewing and shared agreement, through networking to coordinate tasks and give the best of care. So that's talking about the fact that the effectiveness of the multidisciplinary approach is that it helps for policies and guidelines to be followed by all the team members through good leadership, strong teamwork, mutual agreement, and this helps to coordinate tasks and give the best of care. So with all this in place, all these things that I outlined initially, with them all being in place, there is trust, there is understanding. Understanding is built, accurate diagnosis and treatment decisions are made, care is delivered ethically, and the professionals involved are also able to understand the medical care they give. So what are the positives of the multidisciplinary approach? It binds the healthcare workers by a good code of practice to act with the areas of their roles, and all this helps to give good decision making. My slide 12 is talking about the limitations of the multidisciplinary approach. Some of the limitations include poor communication, which could lead to incomplete decisions, poor documentation, which results in incomplete care, and then it's incomplete care because if it is not documented, then it didn't happen. So diversity in the educational backgrounds and an experience of team members is also a major limiting factor. So bad team leadership also affects team results. Changes in team membership and lack of mutual respect affects patients' outcomes. So when there is bad team leadership, it will affect the team results, because if you are not a good leader, if you're not able to lead your team accordingly, it will definitely affect the outcome of the group. And then changes in team membership and lack of mutual respect affect the patient's outcomes. So in conclusion, nurses' actions can create a cycle of change that has a direct impact on health policy. So we have the assessment, nursing diagnosis, the planning, the implementation, the evaluation, and then the evaluation. And that is talking about the nursing process. So nurses' actions can create a cycle of change. In summary, we were able to, so at the end of this presentation, we have been able to discuss the recent changes and their impact on the roles and responsibilities of the registered nurse and the role of the Nursing and Midwifery Council in relation to nursing practice. We analyzed the implication of the Code on Nursing Practice and the role of a registered nurse. We analyzed and explained the need for effective communication and multidisciplinary approach, multidisciplinary healthcare setting, and an evaluation of the effectiveness of the multidisciplinary approach. So at this juncture, I've come to the end of my presentation. If there is any question you want to ask me, you're free to get back to me. Thank you.